Good day to our clinical instructors. Good day, everyone. I'm Meryl Ornada Idian, and I'm going to tackle about the canine parvovirus. Another important canine disease is the canine parvovirus. Canine parvovirus is one of the most important viral disease in dogs that cause parvoviral enteritis, especially in dogs less than 6 months of age. For the classification, this virus belongs to the Parvoviridae family, classified under the Baltimore Group 2. Some of the veterinary important viral diseases under this family are feline panleukopenia virus, also known as feline parvovirus, and canine parvovirus 2, the causative agent of parvoviral enteritis. Also is the porcine parvovirus, all under the genus Protoparvovirus. In this topic, we will be discussing further about the canine parvovirus causing parvoviral enteritis, especially in dogs that are less than 6 months of age. This infection is caused by the species canine parvovirus 2 of the genus Protoparvovirus of family Parvoviridae. This virus causes highly contagious viral disease characterized by severe hemorrhagic enteritis and myocarditis in dogs and other carnivores. For the host range, this contagious virus causes infection in dogs and other carnivores such as cats, fox, skunks, and wolf. For the virus morphology, this virus possesses spherical capsid that is icosahedral structure, and the entire virus is about 26 nanometers in diameter, and this capsid is made up of immunodominant protein or the VP2 capsid protein, which plays a major role in the antigenicity. These are the CPV strains: CPV2, CPV2A, CPV2A, CPV2B, CPV2C. They are differentiated based on their variations in the VP2 capsid protein gene. But currently, CPV2 is no longer present in dog population, but present only in vaccine formulations. The other strains are circulating as field strains among dog populations. Among these, CPV2A is predominantly circulating field strain among dog population, followed by CPV2B, and with some reports of CPV2C. For the evolution of parvovirus strains, canine parvovirus caused by CPV2 emerged as a novel pathogen in late 1970s in dogs and spread rapidly worldwide. This CPV2A is originally originated from feline panleukopenia virus as a consequence of interspecies jump through other wild carnivores like minks and foxes, and later adapted to dogs. But CPV2 underwent evolutionary changes, and within few years, CPV2 has been globally replaced by the new variant, that is CPV2A, reported first in 1980, and CPV2B in 1985. At present, CPV2A and CPV2B are distributed worldwide, but the original prototype CPV2 was no longer circulating in the dog population. Later in 2000, a new CPV strain which was named as CPV2C was reported in Italy. Canine parvovirus can remain viable in the environment for an extended period of time. Parvovirus cannot be decontaminated from the environment by using common disinfectants. Most effective disinfectants against parvovirus is bleach, which is sodium hypochlorite. This disinfectant can be used in kennels, shelters, or cages, and in hospital premises, can be used on tables and equipments before use. Other common disinfectants will not be effective against this virus. The same concepts can be applied in homes. For the virus replication, the canine parvovirus enters the host cell by endocytosis. Following entry, the virus replicates in the nucleus. Here, the genome is single-strand DNA with terminal hairpin structures. And upon infection, first it undergoes rolling hairpin replication to convert single-stranded DNA into double-stranded DNA. Viral proteins self-assemble to form virion. Following assembly, the virion are released from the host cell by the process of cell lysis, and the intestinal villi of the small intestine are highly damaged. So for the transmission, the fecal excretions from the infected dogs and the virus contaminated fomites act as the principal principal source of the virus. This virus is having the portal of entry through ingestion, that is, through oral route of virus entry. The incubation period is within the range of about 2 to 14 days from the entry of the virus. Domestic dogs may pick up the infection from stray dogs around, which are generally not vaccinated. And it can be vice versa. Cats, which are prone to both canine and feline parvovirus, since CPV originated from FPV, can act as source and also susceptible for this infection. Infected dogs act as the principal source of this virus. These dogs shed the parvovirus through its fecal excretions. 1 gram of feces from an infected dog is enough to contain viral material to infect about 10 million susceptible dogs by oral exposure. These virus-infected fecal excretions may be sniffed or ingested through oronasal route by the another dog. So the other dog may become infected and the virus multiplies in the intestine. Now this dog also acts as carrier and shed the parvovirus through its fecal excretions. So it's just a matter of a cycle. Mortality rate reaches up to 90% in untreated cases, and the dog that recovers develops lifelong immunity. For the pathogenesis, following entry of virus through the oral route or through nasal contact, the virus does its initial replication in the lymphoid tissue of the oropharynx, followed by viremia. The virus invade and replicate in small intestinal crypt epithelium, lymphopoietic tissue, and bone marrow. Its clinical manifestations are, if the dog is experiencing severe weakness with foul-smelling diarrhea and vomiting, especially if the dog is less than 6 months of age, and with unvaccinated history, then you can suspect the dog of parvovirus infection. This infection causes hemorrhagic gastroenteritis, panleukopenia, and myocarditis in puppies. Canine parvovirus causes hemorrhagic gastroenteritis, which in turn causes vomition or vomiting and severe foul-smelling bloody diarrhea in dogs. So this may lead to dehydration, and death may occur due to severe dehydration and due to secondary bacterial infection. But animals can recover with early intensive supportive clinical care. Normally, the villi of the small intestine helps in food absorption and act as a protective gut barrier function. But due to parvovirus infection, the virus invade and replicate in small intestinal crypt epithelium, so this will extremely damage the small intestinal epithelium, leading to hemorrhagic enteritis. Ibig sabihin, may presence of blood. And this causes impaired absorptive capacity and the disruption of the gut barrier function. Since the protective gut barrier is lost, the bacteria in the gut can translocate into the bloodstream and causes bacteremia. This is followed by endotoxemia in dogs. So, sa parvovirus infection, sinisira ng virus ang intestinal lining ng small intestine. Because of this, nagkakaroon ng hemorrhagic enteritis. So, may blood nga. Dahil din ito sa disrupted gut barrier, kung kaya yung bacteria ay lumilipat papunta sa daluyan ng dugo, kaya nagkakaroon ng bacteremia. So, sumasama sila sa systemic circulation ng blood. Sunod dito ay endotoxemia. In this process, blood and protein leaks in the intestinal tract and causes severe foul-smelling bloody diarrhea. So as a result, the animal becomes anemic and they may suffer from protein loss. This will end up with shock and death. For the diagnosis, this can be done in field level or in the laboratory. In field diagnosis, it is based on the vaccination history against infection and the clinical symptoms such as foul-smelling bloody diarrhea in young animals, and by post-mortem findings such as hemorrhagic enteritis and myocarditis in puppies. Next, laboratory diagnosis. For live diagnosis, fecal samples and fecal swab are collected, while in dead animals, samples collected includes intestine, intestinal contents, and cardiac tissues. For laboratory tests, we have for antigen or virus detection, we have hemagglutination test, hemagglutination inhibition test using canine parvovirus specific antiserum, PCR by targeting VP2 capsid proteins, and by DNA sequencing. For the prevention and control of of course, we have vaccination. A multi-antigen vaccine is used. In this vaccine, 3 attenuated canine parvovirus 2, canine distemper virus, canine adenovirus 1 and 2, and canine parainfluenza virus are used, and they are prepared in a freeze-dried form. This attenuated vaccine is injected along with 3 killed vaccine comprising the leptospira bacterial species, and this is what we call the 5-in-1 vaccine. For the vaccination schedule, primary vaccination is done at 6 to 8 weeks of age by intramuscular or subcutaneous route of injection. This is followed by 2 booster shots with 2 to 4 weeks interval. And in order to maintain the protective immunity against this infection, revaccination is done every year, or it is done annually. For the treatment, in case the dog get infected, it needs extensive hospitalization. No specific antiviral drug is available for this infection. Only intensive supportive therapy and symptomatic treatment is done, using intravenous fluids, antiemetics, and antibiotics to prevent secondary bacterial infection. You can also use antidiarrheal, but not really recommended because of retention of the intestinal contents, which increases the risk of bacterial translocation and systemic complications with bacteremia and endotoxemia. IV fluids with balanced electrolyte solutions such as potassium and dextrose, antiemetics using ondansetron, antibiotics like enrofloxacin and ampicillin, and also nasoesophagus or nasogastric tube can be used. For anorectic dogs, this is used for continual feeding of a prepared liquid diet, because early enteral nutrition is associated with earlier clinical improvement, weight gain, and improved gut barrier function. So with appropriate supportive care, 70 to 90% of dogs will survive. That would be all. Thank you so much.